Good afternoon, everybody, and welcome to HR for UK's Friday webinar. Can you believe it? 18th of December, the week before Christmas, and here we are still talking about COVID-19 and what impact it's going to be having on your business. Certainly, if we had to cast our minds back to last year, we wouldn't have dreamt of having to be in this situation. But I'm just going to wait a few moments while we allow a couple more attendees who are trying to log on. I can see the numbers going up, so we'll just give them a few moments to get themselves settled in before we get started. When I'll talk to you about preparing your business and getting a contingency plan in place in case your business has to close because you've got COVID-19 cases in your workplace. A quick reminder, today is Friday the 18th of December, it's 3 o'clock, you've got me for the next hour, but I will be here to answer any of those questions, whether it's arising out of today's webinar or anything else. So for those of you who are not familiar, who is HR for UK? HR for UK are a leading provider for HR and employment law support and guidance, as well as payroll, pensions and health and safety services. We've got over 30 years of industry experience and we've got some brilliant 5-star reviews. I would strongly encourage you to go and have a look at our website and read for yourself what our clients say about the services that we offer. Just a quick reminder where you can go, it's www.hrforuk.com and go and read those reviews for yourself. So for those of you, again, who don't know me, I'm Angela Clay. I am an HR and employment law solicitor, but I'm also the Managing Director for HR for UK, and I am responsible for HR for UK's role as a leading professional in HR support to UK businesses throughout the UK, of course. And right from the very beginning of this coronavirus crisis, my vision was for your business to come out of this crisis successfully. And the way that I'm going to be able to do that is by offering you clear, professional, practical advice and support. As I said, when I first started, we were talking about this a year ago. We had no idea what we were in for. Those of you who have joined my webinars throughout the year, I'm sure that you will agree with me and with many others who have reported back with their feedback that the support and guidance that we have offered has been clear, professional, and it has been very practical. And we have been able to support our clients throughout this crisis. So today's topic is, as I said, preparing your business and having a contingency plan for the potential outbreak of COVID cases in your workplace. And the reason why I wanted to cover this is because I had first-hand experience of seeing how a business was ill-prepared in dealing with an outbreak in their organisation. And I'm going to touch on a couple of things that they went through so that you can learn from somebody else's mistakes or as somebody else's learnings. So what we're going to have a look at today, we're going to have a look at how to prepare your business contingency plan. I'm going to have a look at when you need to report cases to your local health protection team. I'm going to have a look at very briefly what you need to do if your business is forced to close by the local health protection team. And of course, communication. Communication is absolutely key. So how do you communicate what's going on to your workforce and of course to your most important, your customers, because they will be wondering what's happened to their services. And then, of course, looking beyond your closure and looking at how you can prepare your business to reopen. And then finally, as a last sort of touch off, I'm going to have a look at what the government support is available for your business, because of course we had some exciting news yesterday when the Chancellor extended the furlough scheme and has made it a little bit clearer for those people who are using the furlough scheme how much longer we've got it for. So of course I'm going to touch on that at the end. But these webinars are only as important, or I wouldn't say important, of course they're important, but as helpful as what those questions are that are coming in. So for those of you who are familiar with our system, please do put those questions in the question box on the right-hand side. It doesn't have to be a question about today's webinar. It can be any question that you may have. And of course, it can also be recommendations for webinars that you would like us to put on, particularly as we start coming into the new year. Maybe we want to start the new year by moving away from COVID, and perhaps you want to start seeing more of those traditional HR webinars. And I'd love to hear from you about what you would like me to share with you so that you can be better in your role in your organisation, whatever that role may be. So do put your questions and concerns in the question box, and I look forward to answering those during the course of this webinar. For those, just as a quick reminder, of course, that this webinar is being recorded, and you will get a copy of the recording after the event. And any questions that do come in, we will collate all of those and we will send them off to you during the course of next week. So do make sure that you send those questions in so that you can get the absolute benefit out of this webinar by looking at those questions and answers, because it's always the case that if you have a question, I'm sure that there is at least one or two other people on this webinar who have the same question. So don't be shy, ask away, and I'll be happy to answer. And if I can't answer the question, I'll be sure to come back to you and do that after the webinar. So let's have a look at today's specific webinar and what I'm going to be covering. As I said, during this national pandemic, it is advisable to have a contingency plan in place so that you can be prepared if there is a forced closure in your workplace due to COVID infections. It's vital that you as a business can continue to operate remotely if you can. Keeping in touch with your workforce, as I said, is very important, and of course keeping your customers and your clients informed as to what is going on if you have to close, and what the correct process will need to be if you have to reopen your business once you have gone through that period of having been shut down through Public Health England. So I've already sort of outlined what we're going to learn today. So without any further ado, let's have a look at how to prepare your business and getting that contingency plan in place. So we know that it's critical for employers to keep their workers and their visitors safe. And we know that we have been given plenty of guidance throughout the year with sector-specific guidance notes that employers can use to reduce the risk of COVID-19 transmission in the workplace between their co-workers, and also what you have to do in relation to staff that need to self-isolate or for members of staff that have tested positive for COVID-19. It goes without saying that working from home wherever possible should continue to be the case, but it is recommended that even after a case of an outbreak of COVID-19, if it is possible to continue working from home in the current climate, it is recommended that this is the course of action. It is vital that employers play their part in making sure that the workplace is safe and secure for their employees to be able to be in the workplace. And we've talked so many times throughout the course of the last 9 or 10 months about how to do that. If you're still not sure, do have a look at our resources. We do have that COVID-19 risk assessment, and we would strongly advise you to make sure that you continually revisit that to make sure that your risk is reduced by putting in different measures as the pandemic unfolds before us. Don't forget, it is a legal requirement for employers not to knowingly allow an employee who has been told to self-isolate to come into the workplace. They cannot work anywhere other than where they need to be for their self-isolation, in other words, at home for the self-isolation period. Because, of course, we also know that there are some significant fines that can be imposed if an employer is coercing their employees to come into work when they know that they are supposed to be self-isolating. The NHS Test and Trace is supporting businesses by providing free testing for anyone who has displayed symptoms of coronavirus. And a part of the support that the NHS Test and Trace system is providing is asking those that do test positive and those close contacts that they've had to self-isolate to try and stop the virus from spreading in the workplace. But of course, employers must continue to ensure the health and safety and the welfare of their employees. But of course, those obligations are similar to other people. For example, if you've got agency workers in your workplace, whether you've got contractors, volunteers, customers, suppliers, or other visitors that may come into your workplace. So I think I jumped the gun a little bit. We are now going to have a look at how to prepare your business for a contingency plan. There's no judgment here, but how many of you have a disaster recovery plan? How many of you thought at the beginning of this pandemic crisis you could go and take it off of the shelf, blow the dust off, and revisit it? How many of you have thought about putting one together but never really got round to it? How many of you have it in your head that if something happens, this is what you are going to do? And again, no judgment. How many of you are thinking, I'll deal with it when I need to deal with it, because quite frankly, it's too much of a hassle and it's too much of a headache to be dealing with right now. So I'm going to share with you where I am, where I was with a disaster recovery plan. And this takes me back to probably about 18 months ago when I was tidying up our GDPR folder. I'm sure many of you will remember GDPR, and part of the tasks of getting my GDPR in place was to complete a disaster recovery plan. And one of the questions that was in the template that I was using was, what about a pandemic? And I remember at the time I glossed over it thinking, wow, we haven't had a pandemic in over 100 years. It's not going to happen in the modern world, modern day, we're not going to have that. But yet here we are. But what I should have thought is we haven't had one in 100 years, we're about to have one any day now. But hindsight is a wonderful thing. But looking at where do I actually start with preparing a business COVID-19 closure plan? And the simple answer is with pen and paper and a clear mind. And I'm going to talk to you how we have put one in place. So start off by thinking of getting together a battle box. Where are you going to be able to find all the information that you are going to need and who is going to be doing what? I don't necessarily mean a physical box, but the battle box might in fact be a folder on a drive where you all have access to. And it will have all the key information that you are going to need in the event that you have to close your business because of COVID-19 outbreak within your workplace. And the starting point is start with yourself. Think about the tasks that you do on a daily basis and start off by writing them down. Start off by arriving at the office. When you come in that front door, how do you get in that door? Well, of course, I've got a set of keys and I'll unlock it myself. But those keys are with me on the person. What if I am not there to be able to unlock the offices for somebody else? For example, I might need to have a specialist company coming in to do a deep clean, or I might need to open it so that we can have public health coming into it. If I'm not physically there with those physical keys, how else is that office going to open? Okay, so think about things. And it might seem, you might be thinking, oh, I'm going to be writing lists and lists of things because I do all sorts of things. But think about what are the tasks that you do that are critical to your business and are critical to ensure that your business can continue to operate if you are not there. Think about what would you need to do if you needed somebody else to step into your shoes. And it's not only going to end with you. Once you've gone through what you need to do, then have a look at each and every role within your organization and go through the same process. Consider all the touch points that those individual roles have with other members of the team, with your customers, and with the operations of your organization. And I'm going to put that all into context by giving you an example of how you can start putting this thought process into place. Because what you're going to need to do is you're going to need to have all those tasks that you have, and you're going to need to be able to assign it. And again, as I say, I'm going to put that into a practical example on how this happened. So an example of an organization, and this is a real life example of where things started to fall down. And this is why it is so important to have a plan. The better plan you have, the more you are going to be likely to be able to respond to what's going on in your organization. So in this particular case, we have a business where they're in the business of providing products to customers and clients. They have an office space, they have a warehouse space, and they have delivery drivers. So they've got internal people, they've got external people who come into their organisation. And they started off with having an employee coming into the workplace who was showing symptoms. Rather than sending that employee home, as we do in the British, you know, how we are being British, we soldier on. We will get on and we'll do the day, and we'll carry on doing the work that we are required to do. Rather than sending that employee home, they intermixed with other people, close working with customers, handing over products over the counter, and so the day continued. Day 2, this employee didn't come in because, of course, the symptoms continued to develop, and by day 2 was quite unwell. Business continued to operate. By day 4, they had 4 employees off. By day 8, they had 8 employees off. Out of those 8 employees, 4 of them ended up in hospital, 2 of them ended up in ICU, 1 of which is still fighting to get back to some sort of normality. So the significance of this started to grow quite quickly. But as soon as we got to getting public health involved, this business was closed. There was no plan, there was no contingency. That's okay, because the business owner took everything on his shoulders. And this responsibility became incredibly overwhelming. It was a hell of a responsibility for this particular business owner to be able to do everything, because suddenly the workforce of 15 people was down to him, from making sure that he contacted all of his staff to say, we've had to close, don't come in, you all need to self-isolate. Problem number 1, he didn't have their contact details. The contact details were in a filing cabinet, in a drawer, in his office, in a place he was not allowed to go because it had been shut down by Public Health England. Okay, so he had all these deliveries that needed to be delivered out. That's okay, we have all the vans lined up outside. Okay, so where are all those keys? All those keys for those vans are with the drivers. Where are the drivers? The drivers are at home self-isolating, so those vans cannot be used. Spare keys were in the safe in the office, but I come back down to the same question, is how do you get into the office if the keys are with me? Can you see where I'm going with this? So again, it's having a look at where all of those contingency plans are. So who was going to deliver all the product? We have another branch 10 miles down the road who could pick up the tasks, but nobody wanted to go into that business because there had been an outbreak of COVID-19. Quite understandably, those workers did not want to expose themselves to that unnecessary risk. So suddenly we had, whilst we could outsource it to a sister branch where they could carry out the work, we couldn't actually continue to deliver. It took about 3 or 4 days for us to reconfigure the assignments to have it delivered from somewhere else. We then had a stock issue because we were going to be, all the stock that was due to be delivered was in this particular branch. Suddenly, we can't have access to that stock. So stock needed to be resourced from somewhere else. Resources were reduced. So again, it was having a look at how could that business get up and running, working remotely, in dealing with all of those things. So when I say have a look at what you do, what every role there is in your organization, have a look at those key touch points and draw up a plan, even if it's a brief plan on how you are going to deliver what you need to deliver to make sure that your business can still continue operating even if your physical office space can be closed, or has to be closed, should I say. But it wasn't just about, you know, the practical side of things, the emotional well-being of not only those who had contracted COVID-19, it was the looking after the well-being of the other employees, because of course they were concerned about their workers, their co-workers, on how they were doing. There was the communication to the customers. It was managing their expectations. And of course, this business owner was riddled with guilt because he felt that he was responsible for making sure that his staff were kept healthy and safe within the workplace. Now, of course, we cannot guarantee all of that, but we can satisfy ourselves by making sure that we do everything reasonably possible to be able to reduce that risk. So a couple of takeaway points from what you can do is make sure that you've got all the information that you need that is accessible without having to physically come into the office. Get that plan, write it down, share out that responsibility, because as a business owner, it will be incredibly difficult to be able to manage the entire business on your own. If you have a plan, everybody knows what they need to do, when they need to do it, it will be far easier to be able to manage the crisis that is unfolding in your organization. I don't want to make it sound like doom and gloom, but what I want to do is to make sure that you are prepared if your organization has to be closed because of an outbreak within your workplace. So let's have a look at when you need to report cases to your local health protection team. So this will happen when you have had a number of COVID cases, and those cases, it's 5 cases that you exceed 5 cases within a 14-day period. You've taken all precautionary measures, but you are still seeing an increase of more and more infections. And another time you will be reporting it where you have concerns that you might need to close your business because of the number of people who are being affected in your business because of COVID-19. And then also a key thing that you might not really think about, but if someone in your workplace has been admitted to hospital and you are starting to get a significant amount of local interest in what's happened in your workplace, because you don't want that negative publicity, you want to be able to manage it, and the sooner you can get public health protection team, the local health protection team into your business to help and support you, the better, because they will be guiding you what to do and when to do it. Every business will be dealt with on a case-by-case basis. Now, where there are more than 2 cases that may be linked through their employment, so we're talking about individuals here, or attendance at a common business setting, the public health team will consider everything, and they will assess whether there needs to be further investigations. They will assess whether there needs to be a closure. They will make that decision as to whether your business needs to be closed. Just because there are 2 cases that are linked to a setting does not necessarily mean that you have an outbreak within your organization, because it may still be that it is coincidental. Now, if you are like me, you might not believe in coincidences and you might think, well, actually there is a connection. But just because there are 2 cases that are linked does not necessarily mean that there is an outbreak within your organization. But as I said earlier on, the public health local protection team will contact you. They will get as much information from you and they will give you advice. So again, making sure that you have the information that you need to be able to impart that with the local protection team will help them deal with the case much quicker and much swiftly to maintain and contain any outbreak that there may be. And the recommendations and the advice that they may give you is that it could mean that you need to carry on operating, but it may well be that you have to have enhanced cleaning. You may need to get all employees tested, or they might actually suggest other preventative measures to break the chain of infection. And as I said, this will be considered on a case-by-case basis. It's not a one-size-fits-all. It will be looking very, very specific to your organization, what you've got in place and what additional things that can be done. And as I say, the public health protection team will continue to work with you as a business owner until any outbreak or cluster has been appropriately managed. They're not going to come in, you know, and leave you in the lurch. They are there in a supportive capacity. There is no judgment. They are there to help you. They are there to contain the outbreak, and they are there to help manage the infection. And then the key thing for them is to get your business so you can continue to operate safely, and that's the key thing. So what do you have to do if your business is forced to close by the local health protection team? As I said, you will be guided by the advice and guidance from a point of contact who will be appointed to manage that. But the key thing is that nobody should go into their workplace if it is closed. It is absolutely essential that you follow the advice from public health as to the measures that you will need to take in place. But from your employees' point of view, they will need to stay at home. And I have talked many times during my webinars about what pay they are entitled to. If you are unsure, do ask, because in certain circumstances you may be able to pay them the statutory sick pay, which is specific to COVID-19, or you might be able to pay them furlough, or you may be able to continue to pay them on your company sick pay, or indeed on full pay. It will be specific to your organisation, and it will be on a case-by-case basis. So communicating with your workforce and customers during any period of closure because of COVID-19, we all know that communication is the glue that holds us all together and will get us through a crisis. And this is especially so in cases of COVID-19, and we would make sure that everybody is aligned on how that communication is going to be communicated out. And it is really important to have a clear, methodical approach to it. Think of it clearly, logically, and in a way that you would want to receive the information. Because if you are dealing in a crisis situation, it becomes chaos very quickly, and people forget to think with common sense, because they are in this heightened state of emotion and can't necessarily think clearly. So it is really important for you as a business owner and the leader of your organization to take control, to make sure that you have those measures in those communications in place. The communication does not necessarily have to come from you. You may want to outsource that to one of your senior members of the team who will be able to manage that, because when we're talking about our contingency plan, what are you going to be doing? I'm not saying that you need to do everything, because you can appoint and allocate different tasks to different people, but different people need to know what those tasks are. So again, having a clear communication plan is going to be really, really essential and important into this. And don't forget that this crisis that we are going through, it is not something that is going to, of course, your closure of your business is going to be for a short period of time, but the long-term effect of this pandemic crisis is not going to be over in a few weeks. This is a marathon. This is something that you will need to have a healthy, steady pace to sustain, because we just don't know what's going to be happening. We still face a huge period of the unknown, and it's really important for you to make sure that you have that communication plan ready to be able to implement it. Planning ahead should be part of your COVID-19 closure plan. Make sure that people know what kind of message you want to be giving, what kind of communication you're going to be doing, and how you're going to be doing it. Having a robust and frequently updated communication plan is absolutely critical and essential. So make sure when you are looking at your communication plan, as I said, it doesn't have to be you, set up a COVID-19 cross-functional team. This is your war room. This is your team that you are going to use, who are going to go and look in that war box that battle box that I talked about, and they are going to implement what is in there. They're going to take that information and they are going to deliver on it to keep chaos down, to keep your business going, and to make sure that the impact is as minimal as possible. Make sure those people who you have assigned tasks to actually know that those tasks have been assigned to them and at what point they need to pick up and action those tasks. Make sure that everybody knows how it's going to be communicated and when it's going to be communicated. Make sure that you recalibrate your plan with HR. That's with us. Make sure that your employee support is there. Make sure that you're communicating that correct information in a way that is not going to be providing you with an HR nightmare after the event. It can be prevented. Make sure that in tandem with HR, you develop and implement a clear communication plan, creating a distinct single source of truth for your employees. It is absolutely important that you don't let the jungle drums start beating their own message, okay? It's very easy to, we've all played it as we were youngsters, you know, the broken telephone. Certainly when I was young, we used to play the broken telephone. It might not mean anything to anybody, any of you, but certainly to me, the broken telephone, you have 1 minute message, and by the time you get to the 10th person, it's a completely different message to what you started off with. So it's really important to make sure that you have that single source of truth coming from a senior member within your organization to make sure that all your employees and your customers and clients are getting that same message. When you are dealing with your employees, it is essential that you are empathetic and you understand the situation that they are in. This is, of course, a two-way process, because you will have concerns, your employees will have concerns, and particularly those who have been affected or infected by COVID-19, there will be other emotions and concerns that are going that will be happening from there. So let's have a look at how you can prepare your workforce for reopening. So a lot of this information is already out there. COVID-19 has been going on for at least, you know, the last 9-10 months, and there's a lot of resources there. But it's important that you focus on the most reputable, the most reliable resource to make sure that you have the right guidance for your business, because there is different guidance requirements for different industries, for different businesses. And government agencies and public health organisations are the best place to find that accurate, updated information when you are looking to reopen your business. And we certainly recommend to make sure that you check on the on the government website, which is www.gov.uk. There is an enormous amount of resource on what to do. The Health and Safety Executive, again, a fantastic resource to be able to get information. And certainly the Health and Safety Executive has got specific guidelines to different organisations, because it'll be different from a factory to what it is to a workplace, to what it is in a care home, to what it is in a car. So there are going to be different requirements that you will need to have a look at. And of course, Public Health England themselves will have clear guidance on how to make sure you can protect your business, how you can get your business ready to come back to being operational once you are given the green light to bring your staff back. But let's have a look at your after a COVID-19 closure. So what changes would you maybe have to implement to ensure that your workspace is now protected? And again, you would have had some key guidance from the local health protection team, who will be working with you to make sure that your organisation is safe, and your health and safety obligations to your employees will be met and satisfied. But it would be a good opportunity to reflect on what has happened. So you should start thinking about, are there any additional measures that you can put in place to make sure that you can continue to operate your business, and how you can reduce that transmission of COVID-19. And it may well be that there is absolutely nothing more you can do because you have done everything, in which case still reflect to give yourself that satisfaction that you have done everything reasonable and everything possible to protect your workforce and to protect your business, to make sure you're not in that same place again. Revisit personal hygiene. You know, make sure that your staff are carrying on, and you enforce that proper frequent hand washing. You know, think about how you can nudge staff to make sure that the frequency of hand washing and hand sanitizing becomes default behavior. Have a look at your signage. Do you maybe need to put on a couple of additional signs? Do you perhaps need to enhance your signage? Think about what additional measures you can put in place. As I've already said, you may already have everything covered, but satisfy yourself by revisiting it to make sure that you have done that. Assess your business's current cleanings and sanitization practices. Again, look at what additional measures you can implement to reduce the spread of the virus. How can your staff maintain those practices? And again, involve your staff in this. Revisit your physical space. We know that we need to keep social distancing. We know that there is different workplaces, work surfaces where there is going to be, you know, this communal area. Revisit that workspace. Do you need to make changes? Think about whether staff can carry on working from home. Do they really need to be in the office? Of course, there are certain tasks that can't be done in the can't be done at home and have to be done in the office. Have a look at those. Is your workplace small? Can it only accommodate a small proportion of your workforce? Do you maybe need to review that percentage of those who are actually in the workplace and those who are working elsewhere, or perhaps on a different rotation shift scheme? Revisit what you have done before to make sure that your workplace is still fit for purpose and is still able to continue. Look at physical barriers. We've all, well, I say we all, most of us have installed sneeze screens. You know, have a look at them. Do you need to make changes there? Has something slipped? Is there something that needs to be done? Look at communal areas. Do you need to make some changes? I've already talked about staggering shift periods and breaks. We already know that large events can't take place. Do you need to go further to reduce that face-to-face meetings? Can it be done differently? Of course, monitor your employees' mental health, their physical health, but also their mental health. But don't forget about yourself, because if you remember when I was talking earlier on about that business that had to close down, the mental health and well-being of that business owner melted into a puddle, and they probably would thank me if they had to hear me, but the resource, they felt extremely overwhelmed. They felt very alone in having to deal with this, because they had to pick up everything from phoning around, making sure the customers knew what was going on, those deliveries could be implemented, making sure that everything could be done. At the end of every day, he was in a you know, an emotional wreck, to say the least, because of the enormity of what he had to pick on. So whilst I'm always saying look after your employees, look after your customers, but you also have to look after yourself. It's important that you have a plan in place, not only to monitor your employees' well-being, but yours as well. And in particular, once you're coming back into the workplace, make sure that you have a focus on those symptoms, because again, looking back at that example that I gave you, what should have happened is there should be a clear communication to all staff that if you have any symptoms, whether you believe you've got COVID-19 or not, do not come into the workplace. It is absolutely critical that that message is absolutely clear to all your employees. It's also an opportunity for you to then have a look at revisiting any policies and procedures that you have in place. So again, it may well be that you need to re-communicate these to your employees, remind them of what is expected. These are very, very difficult times. These are very, very challenging times. Make sure that your staff know what is expected from them. And again, if your policies need to be updated, you need to do that. Of course, if you're a client of HR for UK, we do that for you. Our policies, we are constantly reviewing them. We are constantly making sure that they are up to date. But it's your responsibility to make sure that your employees know where to look for those policies, where they need to go to find out where the latest information is. And of course, continue to communicate to your staff and customers, updating them with your plans and to make sure that they are reassured as to what's going on, particularly when you are reopening your organisation after a COVID-19 closure. So the key thing that everybody will be looking at is to make sure that you will be operating safely and within the rules. And here's a couple of tips on a few must-dos. So when you are communicating, make sure that you communicate on multiple channels to make sure that your message is widely received and reinforced. So that could include social media, WhatsApp groups, you might want to put it onto LinkedIn when you're communicating to customers. You might have an intranet where you would be communicating it to employees. Good old-fashioned, pick up the phone, have those team meetings, have those virtual team meetings, making sure that you use multiple channels to be able to communicate your message. Demonstrate that both employee interests are a priority to the business, as well as demonstrating that customer interests are also a priority, and address any concerns that they may raise directly. You may want to consider creating and sharing a FAQ, frequently asked questions document, outlining specific questions about perhaps your supply chain, your health and safety practices and procedures, potential risks that there may be both to your customers and to your employees, and how you are going to mitigate those risks. So again, it's just revisiting what you've probably already got in place. So finally, let's just have a look at what government support is available to your business. So we know that business struggling will now have until the end of March to access government, the government generous loan schemes. We also know that the furlough scheme, the coronavirus job retention extension scheme, has been extended now until the end of April 2021. The government has also confirmed that they will continue with their contribution at 80% towards wages up until the end of April 2021. And this is going to give businesses and employees across the UK certainty over the Christmas and the New Year period. The Chancellor also announced that he would be extending the COVID-19 business loan schemes until the end of March, because you will remember that all of these dates were to be reviewed in January. But of course, he's, as I say, he's trying to give us the certainty that we need over the festive period and into the winter, because the winter is still got a bite, because we haven't really had a start of winter. So it's just to give the businesses the comfort that they need and the help and support that they're going to need. As I've already said, the employer contribution, you will remember from previously that there was the anticipation that we would go back to a phased increase of employer contributions. But of course, we now know that that will not happen, and that the government will be paying that 80% of wages for the furlough hours. In other words, for those hours that are not worked until the end of April. Employers, of course, will be required to pay wages, national insurance contributions and pensions for the hours that are worked, so that doesn't change. But you will also be required to pay just the national insurance contributions and the auto-enrollment contributions for the hours that are not worked. The eligibility criteria for the UK scheme will remain unchanged. There's nothing that changes there, and it will continue to apply to the devolved administrations. So that's really good news for everybody. Businesses will also be given until the end of March to access the bounce back loan scheme. If you haven't had access to that, that will be available to you. There is the coronavirus business interruption loan scheme, which will still be available to you. And of course, for those larger business, there is the coronavirus large business interruption loan scheme. As I said, those were all due to close in January, and that has now been extended. The government has also announced that there will be more support beyond March, although that will be through different loan schemes. And of course, the devil is always in the detail, and we will wait to hear what that detail is going to be in due course. But the furlough and the loan schemes is just part of a wider plan, and it's part of a bigger plan to create jobs, to protect jobs through its plan for the Chancellor's plan for jobs. And this includes the Kickstart scheme, putting more investment into training and skills, as well as support for the self-employed income support scheme. So the Kickstart scheme, I'm of course delighted to be able to say that HR for UK is the gateway, and we will be able to support you and your businesses in getting a kickstart into your organisation. Very briefly, the Kickstart scheme is open to all UK businesses, as long as you have a company registration number, or you have a charities registration number that we can, well, not we, but the government can carry out their spotlight checks, and those are one of the key things that they do look at. It is aimed at 16 to 24-year-olds, where you would get a young worker into your organisation. The government will pay 100% of wages, national minimum wages, which will obviously vary depending on the age of the placement, for a minimum of 25 hours. Sorry, yeah, for a maximum of 25 hours per week. So of course, if you want them to be there longer, you will need to top it up. Or, of course, you could get a second Kickstart placement within your organisation. HR for UK, I'm delighted to be able to say that we will be able to support you in getting that Kickstart into your business. We will be able to provide the training and development that Kickstart rightfully deserves. And more importantly, to work closely with you in partnership in making sure that that young worker, when they come to the end of their 6-month placement, is well positioned to be able to go on into the work environment and to be able to get a fully paid place of employment, to be able to get that full paid work. So that's all I have for you today. I want to say it's a wrap. I'm going to best guess that there are some gremlins in the system, and I'm going to just veer over to my colleague. I don't have any questions that have popped up into my box, so I'm going to assume that I have answered all of your questions. There's no questions today, so that's from me, everyone. This is a wrap for 2020. May I take this opportunity of wishing you and your loved ones a safe festive season. May you have a Merry Christmas and a Happy New Year, and let's have a prosperous 2020-21. But finally, before you all go, can I take this personal opportunity of thanking you for giving up your time on Friday afternoon, particularly the weekend before Christmas, to listen to me on my webinar, which I really do hope that you have found helpful, insightful, and I do hope that you have at least taken away from today's webinar one little piece of information that you are going to be able to make a difference in your organisation. Don't forget, we do have all the help and support that you need. We are only a phone call away. We have crisis packages that we can help and support you on. And just a quick reminder on how you can contact us. You can contact us on our telephone number, which is 01455 444 222, or you can go to our website, which is www.hrforuk.com, and you can contact us by emailing us, which is info@hrforuk.com. So finally, before I go, our next webinar, Friday webinar, will be on Friday, the 22nd of January, at the same time at 3 o'clock. But before then, don't forget we have our HR surgery, which we'll be back with Rob managing that for me, and that will be Wednesday, the 6th of January at 11 a.m. Finally, last time, have an amazing Christmas. Here's to 2021. Go and enjoy, be safe, and bye for now.